All right, ladies and gentlemen, boys and girls, we are back. Coffee with Doc, episode 23. We're moving forward. It's been a minute that I've been here, so I've been on some vacations and I got married, went on part one of my honeymoon. So I apologize for leaving you folks a little in the lurch, but I'm back, and so we're going to try to catch up and do some stuff. Today, I think what we're going to talk about are peptides. I think a lot of people have a lot of questions on what are they, what ones are available, or which ones have been banned. I think we'll talk about that, and we'll talk about different uses of peptides for different things. So, with no further ado, thank you and for joining us, and let's get started. So, peptides are just particular sequences of amino acids. Our body makes tons of peptides. They're messenger signals to our body to, protein signals to get things done. Generally, they're 50 amino acids in length or less. And when they're bigger than that, they're no longer a simple peptide. Um, so people will come in the office and they'll say, "Oh, I want to do peptides," and I'm like, "Okay." To me, the analogy is it's like putting the dictionary down in front of me and saying, "I want to do words." Um, Wonderful. What is it that you're trying to say? So when it comes to peptides, they do a lot of different things, and we need to know what it is that you're looking to accomplish. So some of the more popular peptides out there that a lot of people don't even know are peptides are the GLP-1 agonists. So your Ozempic, semaglutide, your tirzepatide. There's some newer ones, and these are peptides. And then like with tirzepatide, they've added yet another peptide to it, and so now there's two peptides in there. And the second peptide was there to help to reduce some of the nausea. And I'm sorry because I can't recall that particular peptide. And then there's another one coming out with three peptides, and we are just starting to scratch the surface with these weight loss medications. So, you know, those are peptides that are intended for weight loss. We have peptides that help us with recovery, um, peptides that stimulate growth hormone. There are, peptides to help enhance your immune system. So just really depending on what it is that you're looking to do, there's a peptide for it. Now, recently, within the last year or so, it's actually 2024, the FDA came up with a list of peptides that were restricted for for production or use by compounding pharmacies. Um, they had some reasonings for some of these peptides. I'm not going to pontificate on whether they're good, bad, or indifferent. It's, the FDA can do as it sees fit. Hopefully, with the new administration and new people in different places, this will change, but we'll have to wait and see. So I think it's important to mention some of these peptides, and I'll go down the list, and then I'll come back to the ones that really kind of affected my practice and in my patients because they were a little bit more popular and kind of effective. I won't spend a lot of time on them because I can't get them, and I don't want to waste your time. But that list was, pretty much in alphabetical order. AOD 9604. This was the last 15 amino acids of growth hormone. BPC 157 was a great recovery and repair peptide. CJC 1295. I believe that was a growth hormone releasing hormone. And we'll go into the differences between growth hormone releasing hormone and growth hormone releasing peptides. Dihexa, DSIP. I learned it as deep sleep inducing peptide. I think it has another name. Epitalon. This was, utilized for longevity purposes. Some studies in Europe that showed that it increased lifespan. Um, uh, GHK-CU, the CU is copper. It's still available topically, but no longer available injection wise. A lot of positive effect in literature on this for things like hair loss and healthier skin, dermatologic uses. Ipamorelin, which is growth hormone releasing hormone as well. I think CJC is no, is growth hormone releasing peptide. Um, Man, I have it right here in my handy dandy little book, and I think it was right here. Yeah. And I apologize because some of this, yeah, CJC is growth hormone releasing hormone. I was correct, and then the ipamorelin is a growth hormone releasing peptide. KPV, I have no idea right off the top of my head. LL37, I recall hearing some things that this was really good for some autoimmune issues, if I recall correctly. Melanotan 2, this was also known as the Barbie drug. It helped with weight loss because it caused a little bit of nausea, which decreased appetite. It also stimulates the melanocytes to produce melanin, which when exposed to sun rays, that creates tanning. So for people with skin types 1 and 2 that are very light skinned, this was designed to help them tan easier, and not for the cosmetic effect of tan, but to actually reduce the probability of skin cancer when exposed to sun rays. Now there's more and more studies that have come out that are suggesting that sun rays aren't the cause of skin cancer, but I'm not a dermatologist, so I don't want to delve too deeply into that. And the other aspect of melanotan 2 was its ability to work in the hypothalamus to upregulate libido. So I had a lot of uses. A subunit of melanotan is PT141. That is still available, and PT141 is also a prescription medication used for female sexual dysfunction because it does all the things that melanotan does, but it doesn't stimulate the melanocytes as much. But some people, especially if you have a propensity towards darker skin, it can make you noticeably darker. But it's intended for the libido improvement. I think the prescription name is Vyvanse or Vyvisi. And I apologize because I don't write these prescriptions. I use compounding pharmacies, and I get the less expensive because it's very affordable through a compounding pharmacy, and the commercial pharmaceutical world increased the price almost tenfold. MOTC, this was, I believe, utilized for mitochondrial function and helped to reduce issues with glucose. Ibutamorin, ibutamorin. This is MK677. This is another growth hormone releasing peptide used to stimulate growth hormone. Selnac and CMAX were peptides that we used for brain function, kind of like a smart drug per se. Thymosin alpha 1, which kind of helps the immune system, and thymosin beta 4, which also is a recovery peptide, really helps in healing. So these are the list of the peptides that were kind of restricted by the FDA for compounding pharmacies to utilize. You can still get them online, but I don't suggest you do that because there's no regulatory body monitoring those distributors, and if they're not made properly, some of these can be dangerous, and once you inject something, there's no getting it back. So pretty much all of these peptides occur naturally in the body, and especially like the weight loss medication peptides that we're just giving them in levels that our body could never produce to really enhance the feeling. And some of these are not, you know, produced by the body. So the growth hormone releasing hormones, our body produces growth hormone releasing hormone, but growth hormone releasing peptide, and that, to my knowledge, isn't naturally produced in the body. So I think it's important to maybe talk about the difference between growth hormone releasing hormone and growth hormone releasing peptides. Basically, I think of it pretty simple. The growth hormone releasing peptides, they're a little faster acting, and they do not bind to growth hormone receptors, but they bind to ghrelin receptors. Now, ghrelin is the hormone that is released in the gut that makes us hungry. And so when you use a growth hormone releasing peptide, one of the side effects can be an increase in hunger, and in some cases it can become insatiable. Like the MK677 that was, on that banned list, I had used that because it gave me great results in IGF-1 levels. So I'll go through that physiology here momentarily. But man, I had a lot of patients, and including myself, that couldn't tolerate it because I couldn't stop eating. And you're gaining weight, and it's generally not good weight because you're overeating. And then I had a patient who had a problem eating, and I said, "Oh, geez, this will be a great peptide to give you, and because it makes everybody else hungry, and this person didn't make them hungry." So when I needed it to make somebody hungry, it didn't work. So that was just the one instance. So let's talk about the production of growth hormone. So this makes a little bit more sense. So the body releases growth hormone by the stimulation of the pituitary by growth hormone releasing hormone. This is generally released when we're in our deeper stages of sleep and after strenuous exercise. So generally with the larger muscle groups. And that's kind of stimulates growth hormone. Now, there are some things that you can do to naturally improve the secretion of growth hormone. So exercise obviously would be one. Growth hormone and insulin are inversely proportional. So if you eat glucose or carbohydrates before you go to bed, you're going to inhibit your growth hormone production because the insulin level is going to go up, and that's going to not allow the growth hormone level to go up when you're sleeping. As we age, our body produces something called somatostatin. What this does is it prevents growth hormone from being released. So it's kind of like putting the brakes on the pituitary, even with a good level of growth hormone releasing hormone. So somatostatin can be inhibited with L-arginine, L-citrulline, and L-ornithine. So you can take these amino acids in generally a little higher dose, 1 to 2 milligrams before bed, and it will inhibit the inhibitor, so you're allowing the body to produce growth hormone a little bit better. So these are great natural ways to do it. Estradiol actually stimulates the growth hormone receptor or allows the body to produce growth hormone. So taking drugs that inhibit estradiol or selective estrogen receptor modulator like Clomid or an aromatase inhibitor like an anastrozole, these will decrease growth hormone production. So just bear these simple things in mind. Now, when the body releases growth hormone, it goes throughout the body. And one of the main things it does, it goes to the liver. In the liver, it makes insulin growth-like factor 1, IGF-1. And that does a lot of the work that we associate with growth hormone. So in fact, when we have a patient who has been diagnosed with growth hormone deficiency and the only way to improve their growth hormone level is by direct administration of growth hormone. Um, we monitor the efficacy of that therapy by monitoring IGF-1 levels. Now, some people have an inability to produce sufficient amounts of IGF-1, even in light of normal growth hormone levels. So this is a relatively rare phenomenon, but I have seen it. And the first time I seen it was very perplexing to me because I knew I was giving the patient growth hormone and I knew they were taking it and their levels weren't going up. And I was just like, I just didn't have an answer. Yet they felt better, but I didn't have an IGF-1 level to kind of validate the efficacy of their therapy. So I was a little taken aback because I didn't know if their feeling better was more of a placebo effect or not. But just something to also consider. So we measure the IGF-1 levels to let us know the efficacy of therapy. And then the other thing is that the body also makes, in proportion to IGF-1, is IGF-1 BP3, which is a binding protein. They keep each other in check. Unchecked IGF-1 levels, or IGF-1, is considered to be cancer promoting. But IGF-1 BP3 is the opposite. It prevents cancer. So you want them together. So I personally am not a fan, nor do I recommend for my patients to take IGF-1 unopposed by itself. If we're going to do something, we will stimulate the endogenous production of growth hormone so we get both IGF-1 and BP3 together, or we'll utilize growth hormone, and that, again, will give us both. So that's my take, and somebody may think something different. And if they have, peer-reviewed medical literature to validate that IGF-1 as a standalone is safe, I'd love to see it because from the literature I have and my understanding, by itself, it could potentially cause an issue. So now to the difference between growth hormone releasing hormone and growth hormone releasing peptide. So growth hormone releasing hormone goes directly to the pituitary, and the pituitary spits out growth hormone in proportion to the growth hormone releasing hormone, where growth hormone releasing peptide goes to the ghrelin receptors, and then through some different actions ends up releasing growth hormone. Now, the GHRPs are more rapid, and so their action's faster, the onset's faster, the results are, quote unquote, a little bit faster. Growth hormone releasing hormones are a little bit slower. In a perfect world, we could use both as long as the individual can tolerate the appetite. If because we've got so many that have been banned, so we just have to really look and see which peptides are available. Now, the other thing with growth hormone releasing peptides, they may also increase cortisol and prolactin levels. So if your doctor, I check prolactin levels, and if somebody's using these, we may see that a little bump in that. Let's see. So the growth hormone releasing hormones are more physiologic because they're a little slower, and they'll mimic the body's natural growth hormone releasing hormone, and we'll see normal spikes when we're supposed to see the spikes, and then there's no effect on appetite with them. Personally, I prefer growth hormone releasing hormone over the peptide because it just seems to be less side effects. But again, used in conjunction and used, in particular ways, they can be very effective. I actually have, as you see, I feel like Dan Rather, and that just gave my age away, as I am, kind of looking at through my notes here. But when you use them together, you get a little bit more pronounced growth hormone release, and you get a little potential for higher peak growth hormone levels and more balance in physiologic growth hormone secretion pattern. And then, so like, let's talk about growth hormone. Why would we want to do all this stuff? And I think that's important as well. In my world, growth hormone is a misnomer. It really shouldn't be called growth hormone. That's what it does with children and adolescents. It helps in their height, helps the long bones grow. Once we close our epiphyseal plates or our growth plates, growth hormone isn't going to help the bones grow, but it will make flat bones grow. So if you remember back in the day, Andre the Giant, he got really big, and then when he hit, maturation, he stopped growing height-wise, but his hands and feet kept growing and his head kept growing. So the flat bones in his head, and you get what's known as acromegaly. So his head looked like one of those Easter Island statues because of the acromegaly. And so we see this with pituitary tumors where it may come in a little later in life. There was a fighter named Bigfoot Silva, and big hands, big feet. That's where he got his name, and he had a really big head as well. But he was only, he's only, I think 6'3", 6'4". I think, he may have developed that tumor a little later on after, he reached his mature height, or it may have helped him grow a little bit more. And then he reached mature height, but then the bones of the head, the hands and feet continued to grow. And I don't know him personally, and I'm not his doctor, so I'm only speculating. So you can understand that supraphysiologic amounts of growth hormone can cause these problems. Now, when we're utilizing these peptides or growth hormone, we are not going down the pathway of supraphysiologic, so we're not going to run into those problems. The other question, so what does growth hormone really do? Well, it does help with synthesis of protein. It does have an anabolic effect. It has a synergistic effect with testosterone. So 1 and 1 doesn't equal 2, it equals 3 or 4 as far as, muscle growth. But it's really should be called recovery and repair hormone, because that's what it really does. It helps our tendons, our ligaments, our bones all heal. So it really decreases recovery time. So I guess in athletics, you could say, well, it's cheating if you use growth hormone. It's not making you any bigger, stronger, faster per se. It's just helping you heal faster than the individual who may have low growth hormone levels. So that's an argument for some another day. But I just don't want people to get it misconstrued. The other thing with growth hormone is it encourages the breakdown of adipose tissue or fat and discourages the accumulation of fat. So one of the most remarkable things, after about 3 months of treatment with either peptide therapy or direct growth hormone replacement therapy, is an improvement in body composition, and almost irregardless of diet, within reason. Poor sleep equals low growth hormone, but the converse can be true as well. Low growth hormone equals poor sleep. So somebody who has growth hormone deficiency may find benefit in sleeping when we provide them growth hormone. What else? I think that pretty much covers the kind of growth hormone releasing peptide. There are some that we can still utilize, and I think probably the most popular one, is sermorelin. I have used that in the beginning of when I started my medical practice. What I found was initially patients got good results with IGF-1 levels going up, and they kind of dropped off after 6 months of therapy or so. So as I was looking into a little bit more of the use of sermorelin, unlike growth hormone, when I have somebody who has a deficiency and they're unable to produce it, I put them on growth hormone with no end date in sight, and I don't recommend somebody with growth hormone deficiency to cycle on and off of it because you're just coming off a growth hormone and having nothing. Whereas a growth hormone or peptide, you probably do want to cycle them, and once use them for 3 to 6 months, and then take about that same time off to allow the system to kind of recover, and then you can get back on. Generally 6 months would be my recommendation, because it really takes about 3 months, even on growth hormone, to start to see the physiologic benefits of it. Now, people feel better really quickly, but overall, about six months. So I think that will cover what we want to talk about with the GHRPs and GHRH. If you have questions or you want to know any particular peptide, please let us know, and I'll be happy to discuss it. Now, the other peptide that I really liked was BPC 157, but that's no longer available. What is in its place is pentadecaarginate, and it's one amino acid different than BPC 157. I really like this, both personally and professionally. What I found is it really helps with joint pain. If you have osteoarthritis or even tendinopathies, this really helps to decrease the inflammation and the healing of those tissues. I'm not quite sure that it helps the healing of the cartilage, but it absolutely reduces the inflammation in there. I personally use pentadecaarginate and TB500 before I go to the gym, and it allows me to get through a workout. And I'm still sore after the workout, so it's not inhibiting the inflammation in the muscles at the time, and it doesn't inhibit growth of the muscles, but it allows me to put some stress on my joints that without it, personally, I feel like I walk around like a cripple. So I recommend it for patients if they have elective surgery coming up. I recommend they start taking it, 2-3 weeks before and 2-3 weeks after the surgery. I have had many patients, especially after orthopedic surgeries, recover much faster than expected, to where physical therapists, orthopedic surgeons are asking the patient, like, what the heck happened? You're so far advanced from, at 2 weeks, you're where most people are at 6 weeks. So big improvement in that. The other benefit of both pentadecaarginate, BPC when it was available, and TB500 is that it upregulates the growth hormone receptors. So we can stimulate growth hormone production, and then we can improve the growth hormone receptors. So you don't really need such a jump in IGF-1 levels to get a really nice synergy and almost compounded effect between the two. So you're going to get all the benefits with very little side effects. I do think it's important. When I said side effects, I went, oh, geez, I should have talked about that with growth hormone or anything that stimulates growth hormone production, because that can increase edema, so swelling of the hands and feet. It can lower thyroid functions. So, in my opinion, it's because it's improving metabolism, and kind of that's what the thyroid does. So it's almost helping the thyroid do its job, so the thyroid doesn't have to work as hard. But we do notice that in the labs, the thyroid functions drop off a little bit. There's a temporary spike in glucose levels. Generally, it's self-limited to 3-4 weeks. Then it normalizes, and I think a lot of that is because the body is utilizing the fat from the lipolysis, so it has a better fuel source. It doesn't need to utilize glucose as readily. So carpal tunnel syndrome is another thing that can occur from the use of growth hormone. I don't know that the peptides have shown that side effect could take place, but I figure if it's improving growth hormone, that it could. I tell my patients, listen, because growth hormone improves the rate at which you will recover and heal, you can elect to have the surgery because you'll heal faster, or we can just reduce the dose or stop. So always an option, right? Why do I like these peptides for anti-inflammation over what's typically prescribed NSAIDs like ibuprofen, naproxen, or steroid shot? The real easy answer to that is we know NSAIDs and steroids, while they decrease inflammation, they also inhibit healing. So the tissue no longer hurts, but it isn't healing. So in essence, they make you more prone to further damage long term. And if you're dealing with minor tendinopathies, that could end up leading to continued damage and leading to a tendon rupture, which nobody wants. Whereas the peptides decrease inflammation by decreasing the inflammatory cytokines, and they upregulate healing. So you're getting the best of both worlds. You're strengthening tendons, ligaments, muscle, what have you, and you're decreasing inflammation. So to me, this is the best of all worlds. And I strongly recommend the use of these peptides over NSAIDs or steroids. Now, I was talking with an orthopedic surgeon friend of mine. He agrees with me. We were talking about whether they could be injected safely by a qualified medical practitioner into the joint. And we both agreed that there's not enough evidence because we don't know what it would do to the health of the cartilage. Remember that cartilage is living tissue. So generally we don't recommend that. Except for me in one instance, because I was using hyaluronic acid with AOD 9604 to help with osteoarthritis of the knees. But now that AOD 9604 is no longer available, it would just be the hyaluronic acid. AOD 9604 was kind of on the list to speak about as well. Real briefly, because it was the last 15 amino acids in the sequence of growth hormone, that would seem to be like the key, the active, almost like the other 180 or 76 amino acids. Yeah, we're not doing much, and it was like those 15 were doing everything. But the real focus on the AOD was called anti-obesity drug, because that's the aspect of the growth hormone that we had seen the increase in lipolysis and inhibition of fat accumulation, lipogenesis. So that's why we really liked AOD. And then why it worked in the joints is because the healing effect of growth hormone. But again, after speaking, with speaking with my colleague, who is an orthopedic surgeon, I wouldn't recommend doing that anymore because now we can't even get it. So, so one question was like, can peptides target particular types of fat? I do have a little information in that. So, tesmorelin, I believe, is still available. It seems to work on visceral fat reduction, and it seems to work better in females than in males. So that's a possibility. When it was available, ipamorelin seemed to work a little bit better at subcutaneous fat reduction. But again, that one is on that list, so really can't do much with that. Outside of that, I think it's just the improvement in growth hormone alone is going to help the fat reduction. What lifestyle factors can enhance the effects of fat burning peptides? Well, to me, common sense, but that's diet and exercise. So you keep away from sugar, insulin spikes, high fiber diet, lots of whole foods, and exercise, both weight resistance and cardiovascular exercise. Um, there's a question on how can peptides like epitalon extend lifespan or improve overall health. I just want to say that it's touted to do that. I have information on that, but at this juncture, it's not even worth talking about because it's on a restricted list. So, peptides and sexual health. I think the biggest peptide when it comes to sexual health is PT141, bromellatide. It's now a prescription medication, but it does work at the brain level to upregulate libido for both men and women. And men, it has an effect of 2 to 4 days. So you can improve erectile function without the use of Viagra, Cialis, things like that. And also, not only does it improve the erectile function, but it improves the drive. So it's helping both. Same thing with women because the tissues are generated from the same area, so it's helping drive, but it also improves blood flow to the clitoris, which improves sensitivity, which helps with the experience. Question about peptides legal for use in different countries. I don't know. I practice in the United States, so I can't speak to different countries. Side effects of particular peptides. Well, I kind of covered those. Most of these peptides are injectable, so you have to be okay with injecting yourself. You have to be trained or knowledgeable in self-administration of these, and understand that anytime that you break the skin with a needle, you open yourself up to infection, up to an abscess. So you have to be very careful. You're using a small insulin needle. I've seen this in the emergency room where people have broken that needle off into the skin. So you just be careful. When you're seeing a qualified healthcare professional, they should supply you or give you a prescription for plenty of needles. Use the needle once. Don't reuse it. It's not worth it. Each time that you poke the vial and then you poke yourself, you're dulling that needle. And if you put it under a microscope, you'll see the fine tip of that needle starts to peel backwards. And then you can imagine it becomes almost like a fish hook. And so it's at a microscopic level, but you're damaging tissue, putting it in and putting it out. So just please use it once. How can someone ensure they're getting a high quality peptide and not a fake? Go to a qualified healthcare professional. Get it from a licensed United States pharmacy. Do not order it online. That's the best advice I can give you. Biggest misconceptions people have about peptides. I'm not sure. Unless somebody brings up issues to me. Are they safe for long-term use, or do they have unknown risks? I mean, they're relatively new, but so far the studies that have been done, and they're getting more and more, they're showing they're safe. We can talk about the weight loss medications. I've got plenty of studies that say that they don't increase the risk of thyroid cancer. I've seen some other studies that say they do. I think that they from my studies that I've read, I'm pretty convinced that they don't, and if it does, it's very, very minimal. Most of the side effects, I just read a paper in a New England, no, it wasn't New England Journal, JAMA, excuse me, that was looking at the use of peptides in non-diabetic, non-obese patients. So for the vast majority of the patients that we see, that they don't meet the criteria for the commercially available peptides, they want to use it in microdosing for the anti-inflammatory effects, for weight loss effects, for the positive effects on autoimmune disease. They're not seeing any side effects outside of the typical nausea, maybe some abdominal pain, cramping, some vomiting, diarrhea, or constipation. But we're not seeing we're not seeing an uptick in pancreatitis. We're not seeing any cases of paralytic bowel or ileus. So, the cases of that are generally related, like the cases of ileus are generally in diabetic patients. Diabetic patients have a 2 to 3-fold increased risk of ileus all by it themselves without a GLP-1 use. So it goes to question, is the is the peptide responsible for their medical concern, or is it their diabetes? And I don't know, but for me, when we prescribe these medications, I do an informed consent and let people know that this is a possibility, but it is very unlikely. What should beginners know before experimenting with peptides? Don't do it on your own. Go see a qualified healthcare professional, somebody who's well versed in this. I took a certification course in peptide therapy. Oh, goodness. Prior to COVID coming out, so it's been 5 years easy, and it's probably longer than that. I'd have to look at the certification, but I probably need to go and take another one because there's more and more peptides coming out, and I'm not aware of them. So, for me, I have a friend and colleague who wrote a great book. If you're really interested in learning more about peptides and some of their therapeutic uses, and it's almost a step-by-step how-to with peptides. And Jimmy, you're not paying me, and I love you, so but I'll give you a shameless plug for the Peptide Handbook, written by my good friend Dr. James LaValle. And when you say doctor, he is not a physician; he is a doctor of pharmacy. Probably one of the smartest human beings I know. So if you're interested in learning more about peptides, this would be a great book. But hopefully you've learned something from this, and if you want to talk to a healthcare professional and you're in the Las Vegas area, I'd be happy to discuss in more detail what's available and what we can do for you. So thank you for your time. And if you have other subjects that you want to talk about, please comment in below and like and subscribe to our podcast. Thank you.